Hi, I'm Kate, and I'm an evidence synthesis analyst at the NIHR Innovation Observatory. I'm part of a group that's been looking at how we can use soft intelligence more effectively and how we can use it as an evidence source to inform future healthcare innovations or policy. We've been exploring lots of different applications for soft intel. In this particular presentation, I'll be talking about how we've analysed global tweets relating to different types of COVID-19 vaccinations. So what is soft intelligence? The term is often loosely clumped together as any alternative to traditional hard data sources. Examples of this include data that is collected in a very informal or unstructured way, often in narrative or discussion formats such as social media, online forum, news stories, or commentaries. In the context of our research, we thought of soft intelligence as gathering lots of qualitative human feedback and analysing this in a way that can be translated into actionable insights. It's only very recently that we've been able to tap into the masses and masses of text data that is available online as a potential evidence source thanks to the rapidly evolving capabilities of artificial intelligence. Natural language processing and machine learning tools are now able to analyse all of this unstructured text data and find clusters within that to automatically identify the key topics of discussion and identify the overall sentiment expressed within the text. Soft intelligence is increasingly being used by businesses as a social listening tool to gain rapid consumer feedback. However, when it comes to healthcare policy and decision making, it is being largely overlooked as a means of gathering actionable evidence. Potentially, there is huge value of soft intelligence with healthcare, owing to the enormous wealth of information now available that can be rapidly analysed. The scope is also less confined than traditional survey-based research methods and could extract insights that would otherwise have been missed. Therefore, we sought to explore the value of soft intelligence as an evidence source for informing policy and decision making by establishing if analysis of social media discussion using global Twitter data could identify key themes in public attitudes toward COVID-19 vaccines. So we set up a search strategy comprising a list of all COVID-19 vaccines in development using Twitter's application programming interface. The search ran for a 12-week period from the 30th of November to the 21st of February. We then created filters to categorise the vaccines according to their mechanism of action, and these filters are listed there. Next, we deployed a specialist analytics platform that uses natural language processing to examine tweet volume, sentiment, and key topics of discussion within the scraped tweets. The vaccine category filter was then applied across all of the scraped tweets so that we could evaluate if there was any difference in volume, sentiment, or key topics of discussion. Finally, after the platform had automatically identified key topics of positive and negative discussion, research from our group manually went through and read a sample of tweets in each key topic to try and understand the reasons underpinning the sentiment. This chart here shows that the vast majority of tweets we collected were in relation to the non-replicating viral vector and inactivated virus vaccines. We would have expected more tweets related to the RNA vaccines, but this is one of the limitations, is that because the tech isn't quite capable of analysing the millions and millions of tweets that would have been scraped had we included the common names for the vaccines in our search, we had to refine it and just use the trade names. So therefore, trade names like BNT162B2, more commonly known as Pfizer, wasn't often included, whereas trade names like Covaxin, Covishield, Sputnik, and Coronavac were disproportionately scraped during our analysis period. However, in other projects, we have been able to use broader search terms and in order to incorporate these different terms for the vaccines amongst just the UK population. Over the 12-week analysis period, we scraped over 135,000 global tweets that mentioned and named COVID-19 vaccine. And interestingly, the volume of tweets and therefore discussion around the vaccine could be quite easily mapped to key events in terms of vaccine approval and development timelines. So at the start of our analysis period in November, only the Russian Sputnik vaccine had been approved and all others were still in phase 3 trials. Towards the end of December and into the beginning of January, there was lots of activity in terms of vaccine approval. There was the MHRA approval of Covishield, Indian approval of Covaxin, and various other regulators approved vaccines in this period. So there was a huge spike in discussion. There was a second smaller peak of around 15,000 tweets per week in the first week of February, again coinciding with the publication of phase 3 Sputnik results, and phase 3 Sinovac results were also released in this time period. We then moved on to look at the sentiment of tweets, and the platform we used deployed artificial intelligence to give a sentiment score expressed as a percentage for each tweet. Tweets above 50% are considered to be positive, below 50% are considered to be negative. The average sentiment of tweets across all vaccine categories was 52%, suggesting an overall positive score. And when we look specifically at the two vaccine category types that were most discussed, the non-replicating viral vector and inactivated vaccine, we can see that there was considerable difference in sentiment. There was much more positive percentage of tweets for the non-replicating viral vector and much more negative percentage of tweets for the inactivated vaccine. So we then sought to use topic analysis to understand why this might be. So the platform uses machine learning to automatically group tweets into key themes that were discussed positively and negatively. And this slide here shows the 5 themes discussed most positively and 5 discussed most negatively overall. Further analysis by manually reading through a sample of these tweets meant we were able to establish that release of scientific data was an important driver of sentiment, given two of the key topic areas discussed most positively were in relation to efficacy and safety of vaccines, whereas rushed approval before completion of phase 3 trials or before the release of publicly available data was discussed with negative sentiment. Negative sentiment was also detected in relation to people discussing poor results from vaccine trials in various countries. The other major theme we detected was a strong sense of vaccine nationalism. Users often expressed extremely positive sentiment in relation to a vaccine that had been developed in their own country, but there was considerable skepticism in relation to vaccines developed by other countries, particularly China and Russia. This vaccine nationalism trend was also reflected in our topic analysis by vaccine type. For the non-replicating viral vector vaccines, a lot of the negativity was being generated by the Russian mass rollout, tweets about the Soviet Union, mistrust of the Russian government, and this was despite positive results of the Russian Sputnik vaccine being released in a scientific journal. In contrast to this, in the inactivated vaccine category, the majority of the negative sentiment was based around the rushed approval of vaccines and poor trial results, rather than mistrust of the Indian government. And actually, a lot of the positive sentiment being generated in the inactivated virus category was users from India expressing joy that their vaccine, that vaccine had been developed in India. Many of the 12-week topics, many of the topics remained the same over the 12-week analysis period, and the only difference we detected was at the start of the analysis period there was a lot of concern about side effects, and over time this waned in favour of more discussion in relation to the release of efficacy data and safety data, and concern about if the vaccines would be effective against new strains. Overall, we concluded that soft intelligence may complement other methods of research and evidence gathering to inform healthcare policy and decision making. We were able to identify peaks in COVID-19 discussion by tracking volume of tweets over time. We were also able to track changes in public perception using sentiment scores and topic analysis. We were also able to identify rapidly emerging themes in public discussion through automated topic analysis. This could be useful in informing healthcare strategy. For example, we were able to identify that feelings of national pride towards a vaccine developed in a user's own country and increased trust based on release of scientific data were key factors in positive sentiment towards vaccinations, whereas concerns related to efficacy of a vaccine or mistrust of a particular country were likely to result in negative sentiment. These insights could be used in combination with other methods of evidence gathering to inform messaging and public engagement to result in maximal vaccine uptake, although further work is needed to investigate this. Some limitations of this project included that the demographic of Twitter doesn't reflect the demographic of the population as a whole, and the tech is still in its infancy, so there were some slight inaccuracies with how the platform classified the sentiment of tweets. And finally, here's the acknowledgements and disclosures that the NIHR would like me to include. Thank you for listening.